behaviors.
As we wrap up this part of our discussion, what do you think are the most useful ways people can deal with stress, with the mind-body connection, both people themselves and also what doctors should be telling their patients or what patients should be telling their doctors?
The body has many ways of saying no. Almost any symptom, a stomachache, a back spasm, a headache, nausea, dry mouth, poor sleep, muscle tension. I'm talking about relatively minor symptoms. These are all ways of the body saying no, as of course are the more severe conditions like psoriasis or ulcerative colitis, all the ones that I've already mentioned. These are all ways of the body saying no. We need to, first of all, to say and pay attention to what the body's saying to us. So if we have a symptom, don't just go to the doctor and say, take this symptom away from me. Yeah, ask for help, but also explore what the body's saying no to. Usually you'll find that in your life you've taken on too much, you're suppressing yourself, you're trying to please others too much, you're living life along patterns that don't express who you really are. So the symptom or the disease ought to be not just something that you want to get rid of, it ought to be the beginning of an exploration, an investigation of how you live your life and how you might possibly live your life differently in a more healthy fashion.
And do you think modern medicine is dealing better, Western medicine, with this, with the mind-body connection?
There are encouraging signs. There's certainly people like John Kabat-Zinn, who talks about stress and mindfulness, and Andrew Weil, who talks about the importance of nutrition and a more holistic approach. So there are many people doing great work, but if I look at the profession as a whole, we're doing a dismal job. And we're spending billions of dollars on researches into cancer and so on. That's never going to get us anywhere because we ignore the life stresses that very often, if they don't by themselves cause, they certainly contribute in a major way to the onset of disease, but we're not looking at them, we're not dealing with them, and we're leaving people without the appropriate tools to restore their own health.
Dr. Gabor Maté, I want to thank you for being with us again from Vancouver today. As we break the sound barrier, he is a best-selling author in Canada, now bringing him to the United States. The book we're talking about, When the Body Says No, Understanding the Stress-Disease Connection. His most recent book, just out, is called In the Realm of Hungry Ghosts, Close Encounters with Addiction. That does it for our broadcast. Democracy Now! Is produced by Mike Berkshire, Dr. Sarah Maté, Angelique Comet, Steve Martinez, Nicole Salazar, Hani Masood, Robbie Karen, Mike DeFilippo, Peter Curries, Miguel Noguera, engineer. Special thanks to Becca Staley. I'm Amy Goodman.